Have no intentions of paying this bill. I mean, when I was in your hospital, I had to wait for 5 hours in the waiting room along with probably 60 kids who were probably there for runny noses, and by the time I even saw the doctor, I wasn't even an emergency case anymore. I can't justify paying this bill. I was so dissatisfied with the services.
Okay, so when you hear this type of complaint, it's no wonder that Laura is divorced. I'm just kidding, by the way. But you have to say to yourself, how would I handle this call? And if this call came into me, I would handle it this way. I would say, Laura, I'm sorry to hear that you had a bad experience in our hospital as we strive for patient satisfaction. But here's what I can do for you. First of all, the fact that you stayed around and received the services, I'm happy to hear that. And it seems to me that you're feeling better. However, if you would, put down your complaint in writing, send it off to me, but you are going to have to include the balance due. Once I turn that over to my supervisor, I promise to get back to you if the hospital feels that we would do anything regarding this outstanding balance. I'm going to let her know that I hear your complaint, but you did not make it at the time of service, but rather later. You did receive the services, and remember, you're calling that patient for a balance due for the services rendered. And that's your role. You rendered the health care, now you expect payment. In the very beginning, you have to be friendly. You are competing with outside callers. You are competing with telemarketers. You are competing with other providers. You are competing with other bill collectors. You are competing with everybody else that has her phone number. So realize you have to get your best foot forward right away. So when she says, hello, Laura, I'm going to say, hello, am I speaking with Laura? Now I'm going to give her an opportunity to somewhat either lie to me or say yes. Or if she answers and says, hello, I'm going to say, Laura. Once I've identified her as the guarantor, I then am going to make sure I identify myself and also my employer. Hi, this is Tony DeMore. I'm calling you from XYZ Hospital. Say this slowly. Why? Chances are, 28% of the time, you're on her cell phone. It's critical that you realize, where do you answer your cell phone? When you're driving? Sure. When you're in the mall? Absolutely. When you're in a crowded hotel? Sure. When you're at the soccer game? Yes. So realize she may be defensive because you're contacting her on her cell phone. So speak slowly, speak clearly, but whatever you do, get to the reason that you called her, and that is to get payment for the services that were rendered. The third line, request payment in full today and offer the methods of payment that you can accept. You have to realize that she is now past due. She is beyond delinquent. She is in default. You can't teach her that because you don't pay your bills in 90 days, you get a better deal. So you start out always asking for that balance due. When you get to the part where you say to her, I have an outstanding balance of $500, and for your convenience, the hospital offers Visa, MasterCard, Discover, or I can take a check payment over the phone, debit or credit. You have to ask her or let her know how she has the ability to pay you. Once you've done that, we say psychological pause. In other words, don't overtalk it. Realize that you must determine what the problem is, and it is your role to find the solution. She is going to tell you a reason that this bill is outstanding, and you need to be able to talk that off. Once you close the deal, confirm the payment arrangement. A lot of times people will spend a lot of patient account reps will say, could you tell me when you get paid? And can you tell me when your bills are due? And can I set you up on the 15th and the 18th and the 20th and you don't get paid that week, but you get paid the following week? This kind of stuff is crazy. Here's what you have to realize. Patients, like yourself, have the same financial arrangement with creditors that you do. And what do I mean by that? When are your bills due? Well, your mortgage payment, usually in the first 5 days. Your car payments, usually in the first 10 days. Utilities, usually the first 15 days. So when do you really have money if you're a patient? The last week of the month, the last paycheck you receive. So how would I work with a patient? I would say to them, look, Laura, since you're willing to pay me $50 every month, I'm going to make your due date the last day of the month. However, I need you to allow 5 mail days for delivery so that the payment is received in my office by the last day of the month. Again, it's convenient for the patient. It gives you a good talk off. It shows your willingness to work with them. So, on the area of the Terry being unemployed, what I hear from Terry is that he says in the beginning that he wants to pay it. I would give him a small term arrangement. I would hope that his situation would change. And more importantly, I would let him know that it is a temporary arrangement. Last thing we're going to do here is update the records. When you update your records, they should be completely accurate. Nothing is worse than when a patient calls back your office and your records aren't updated, and they start to tell you what you've done wrong. Common objections and excuses. Here are some of the things that I hear. My insurance was to pay, my employer was to pay, I'm unemployed, it's my spouse's obligation, I'm divorced, the doctor made me wait, I wasn't happy with the service, I'm on a fixed income, I dispute the bill, I'm not the guarantor, I'm not the patient. The woman at the front told me I didn't owe the money. The ride was way too bumpy. The doctor only saw me for 5 minutes. I never received a statement. I believe that all of these excuses and objections are the ones that you will continue to hear for the next 15 years. I wrote this slide 15 years ago and we have very little changes. So what I'm saying is, if you become good at removing these excuses and you role play and practice, you will effectively remove and understand how to remove the objections and excuses that patients will offer. What are the best times to call patients? Well, 8 to 10 a.m. is still the best time because I think you still have some folks at home in the morning that are trying to get their kids off and maybe they start work a little bit later. And nowadays you have a lot of telecommuters. You have people that are working right at home a lot of part of the day. We also think that 5 to 7 p.m. is a great time to make calls as everybody's getting home from work. Remember, if you're not getting a hold of them during the daytime, it's probably a good thing because it shows they have the ability to at least pay because they are at work. What are the best days to make the call? Thursdays are without a doubt still the best days. 56% of the time, or 56% of the folks are home on Thursdays. My personal opinion is because they're broke waiting for Friday. I don't know if I'm right or not, but that's just what I think. I'd like to share with you a desk helper that we created, as I think it's a pretty important item. A lot of times providers don't have any tools. Typically when I say to a provider, how is it that you learned how to do talk-offs? They would say to me, I learned from Sue, I learned from Jane. And then I would say, well, where did Jane learn? Where did Sue learn? Oh, well, they were in accounting, or they were in billing. And then I say, well, what kind of experience did they have? And I find out that nobody really has tools to train patient account reps. Most of them are learning by parroting. They're learning by their predecessor. And no one takes the time to really effectively learn how to remove the excuses and objections. What I've done is create this product here, which basically is a desktop. And I'm not sure if you guys can see this, but it sits on a desk. And it does have a flipping effect to it here where you can say, okay, well, let's talk about I will pay something when I can. If I were to have this person on the telephone, it lays out exactly the dialogue that I should have to be able to speak with that patient. I think these types of tools are very helpful when you're getting new people who require some training, or just as a training tool inside your own organization. Well, thank you very much for attending, and I thank everybody out there for your time today.